This video is about the brain, which is one of the most complex organs in the whole body. Its function and its structure are not simple. It's part of the nervous system. It's part of the central nervous system along with the spinal cord. We'll deal with the spinal cord in another video. The most obvious feature, let's get oriented first so you know which direction is which. This hand over here, this is the front of the brain, or the anterior part of the brain, and back here is the posterior part of the brain. Okay, then this is the superior part of the brain, and this is the inferior part of the brain. And then if you see, the biggest part of the brain is the cerebral hemispheres, or the cerebrum. The cerebrum has two hemispheres, as you can see. I'm going to take it apart in a minute, but you have a right brain and a left brain. You've heard those terms before. And then here is the longitudinal or sagittal fissure that divides the two hemispheres. Okay. Now, while we're on the outside of the brain, the first thing we want to do is to take a look at the different lobes of the cerebrum. Okay, we'll look at these several times because they have different functions and they're different structural components of the brain. Okay, but as you might guess, the front of the brain, that lobe is called the frontal lobe. The frontal lobe. And then this lobe back here, just like the parietal bones, these are called the parietal lobes. And then in the back here, you see the terminology is paralleling the skull. This lobe back here is called the occipital lobe. And then the lobe on the side is called the temporal lobe. So we've got what? Frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Okay, now separating, very important feature, separating the frontal lobe from the parietal lobe is the central sulcus. The central sulcus. Now, what a sulcus is, it's a depression. You have grooves and you have ridges all over the brain. That's what gives its appearance. And the low regions, the depressed regions, are called the sulcus, and then the high regions are called the gyrus. This sulcus right here separates the frontal lobe from the parietal lobe, and it's called the central sulcus. Okay, and it's important because the cortex, which is the outer layer of the brain, in front of the central sulcus, is called the primary motor cortex. Okay, and it's very interesting about the primary motor cortex. They've mapped it. If you stimulate a certain region on it, that part will move. Okay, like if this is tongue, person will stick their tongue out if you stimulate that. If this says thumb, then if this part's the thumb, they'll move their thumb. Or if this part's the pinky. They've mapped what each region of the primary motor cortex in front of the central sulcus. Again, cortex means outer layer, and it's right in front of the central sulcus. What part will move? And then the other part is the sensory cortex. The sensory cortex is right behind the central sulcus. And you see the motor cortex is what? On the frontal lobe, and the sensory cortex is on the parietal lobe. And here, if you touch a certain part, of it, the person will get a sensation in a specific part of their body. So we've got a sensory cortex and a motor cortex, and what divides them is the central sulcus. You can see the parietal lobe is kind of this purpley color. It's below the parietal bones. Then if we turn the skull back this way, we'll see the occipital lobe, and the occipital lobe is concerned with vision. If you bump the back of your head, you've got to check your vision, because the visual cortex is right here. See, it's a little bit different color than the rest of the occipital cortex. Okay, and then on the down here sticking out, you might be interested. This is the cerebellum. We're going to talk more about that in a minute. See the cerebellum, and then down below the cerebellum, that's going to be the medulla oblongata. We're going to look at this in a sagittal section in just a minute. And then if we look at the lateral side of the brain, we'll see this lobe right here. This is the temporal lobe, and the temporal lobe of the brain is involved with hearing, with auditory. There's auditory cortex. Remember that the outer layer of the brain, that tissue is called the cortex. The cortex. So before we go to the sagittal section, let's review what we know. This is the front of the brain, so this is the frontal, let me turn it this way, frontal cortex. Then the frontal cortex is separated from the parietal frontal lobe, is separated from the parietal lobe by what? The central sulcus. Now the elevated region, or the gyrus in front, is called the primary motor cortex, and the one behind is called the primary sensory cortex. This is the parietal lobe. Then this is what? The occipital lobe in the back. It's involved with vision. There's the visual cortex. And then on the lateral aspect, we'll see the what is this? This is the temporal lobe, and it's involved with hearing, with perception of sound. And also you can see below, here's that cerebellum from the side, and there is the medulla oblongata, and the pons is right. I think I'm pointing to the pons. The pons is right above it. So now let's look at a sagittal section. Let's put that brain aside and look at a sagittal section. And a sagittal section, see this, all this big outer stuff, that's the cerebral cortex, okay, and the cerebrum, okay. Then if we look at this big white thing is called the corpus callosum. Corpus callosum, and it integrates between the right and left cerebral hemispheres, okay. And so then below that corpus callosum then is the thalamus, okay, the thalamus, and the thalamus is a relay center, and then below the thalamus is the floor of it is called the hypothalamus below, and then that goes down to, I think you can see it here, it's not a very good depiction, but it goes down to the pituitary gland. Let me just make sure. Yeah, this right down here, this little stick out from the bottom comes out from the hypothalamus, which is the floor of the thalamus. This is the corpus callosum. Okay. Then coming in down here to the brain is the what? The spinal cord. Okay. At this lower part of the brain, it's called the brain stem. That's called the medulla oblongata. The medulla oblongata. There's your cerebellum back there. And then this piece right up here, this part of the brain right up here, is called the pons. The pons, the medulla, the cerebellum, the thalamus, the hypothalamus, the pituitary gland coming off of the hypothalamus, and then this is the thalamus, hypothalamus, pituitary gland, and corpus callosum. Okay, so I hope that starts to give you some basic understanding about the anatomy of the brain. Let me just review right here. This model's neat too. It's a smaller model, but it's got different colors, so it might help to take a look at that. This green right here is the frontal lobe, going back here to the central sulcus. Remember, in the central sulcus, and then you have the motor cortex in front of the central. It's called the precentral cortex, or the motor cortex. Here's the sensory cortex below it. That's called the post-sulcus cortex. And then coming back down here, you have the occipital lobe, and the occipital lobe in the back. Okay, parietal lobe, then occipital lobe. And the very back is the visual cortex, where the impulses for vision come in. And then if you look at the sagittal section, you'll see the corpus callosum, and then what? This is the thalamus, the hypothalamus, the pituitary gland, the pons, the medulla oblongata, and then the cerebellum. So I hope that helps you a little bit to know the anatomy of the parts of the brain. Yoo-hoo, I'm up here.